So good afternoon, everyone. For everyone who is joining us and hasn't had an opportunity to work with me in the past, I'm Dr. David Sarwer. I'm the Associate Dean for Research in the College of Public Health and also Director of the Center for Obesity Research and Education. And I'd love to welcome all of you to today's session related to our events around National Public Health Week. And I'm really thrilled to have Jeannie Blankenship join us today. To talk about the work that she does with the Academy of Nutrition and Dietetics. And I think it's really timely on multiple different levels. One, that we know that issues around food and nutrition policy, whether we talk about issues around obesity or food insecurity, are not always critically important in most years, but have actually come to the forefront for many people just with the demands of the last 15 months as we've dealt with the pandemic. I just heard an anecdotal report yesterday from a colleague who said that she's hearing about teenage students who are coming back to the classroom who have gained a significant amount of weight during the pandemic, and that their teachers and school nurses are observing that they're getting winded as they're walking through the hallways of the school, that they become that deconditioned over the past year. But I also think this session is really timely, given where we are in the college with our focus on nutrition and food sciences. That, as many of you know, we have a very active and vibrant nutrition program, nutrition club at the undergraduate level that does amazing work. We've increased our course offerings in nutritional sciences, and as many of you know, come the fall, we're going to be launching a new accredited MPH-RD degree at the graduate level, which will give those interested in nutritional sciences an opportunity to really advance their education within the fabric of the college. And I can really, in some ways, think of no better person than Jeannie Blankenship to come and talk with us today about some of these issues around advocacy for food and nutrition policy. She's the Vice President of Policy Initiatives and Advocacy for the Academy of Nutrition and Dietetics. And we had the great pleasure of working together several years ago where we edited a textbook. And while this is not the exact textbook, we actually edited the second issue of the American Society of Metabolic and Bariatric Surgery's textbook on bariatric surgery, along with our colleague and friend Chris Still. We were responsible for the medical and the nutritional and the psychosocial aspects around bariatric surgery. And we did such a wonderful job that they actually didn't invite us to update the most recent version a couple of years ago, because this is clearly a seminal work that will stand the test of time and didn't need to be updated. So with that, it's my great pleasure to see my colleague and friend again and to introduce her to all of you as she talks to all of us about the work that she and her colleagues do advocating for food and nutrition policy. Jeannie?
Thank you so much, David, and just a big congratulations to all of you for your new program. That's really exciting to see that being launched, and I think there's such a demand for that combination between MPH and RDN. So just kudos to all of you. And when I get to the end, I'll talk about some opportunities that we might be able to offer some of your students moving forward in the future. I'm pleased to be able to talk about advocating for food and nutrition policy as a pillar of public health. These two issues go hand in hand. They are peanut butter and jelly, if you ask me. This is a passion area of mine. David talked about our work together in the obesity world, and being able to advocate and to have that clinical background to speak on behalf of registered dietitians, nutritionists, and be one myself is something that is not really all that common on Capitol Hill. A lot of the other lobbyists are not necessarily representing their profession. So you don't always see surgeons working as lobbyists. They may come in and lobby for a day, but to ingrain a professional into the lobbying world and to be able to advocate is really important. It allows me to talk about issues really from the heart and from the background of the science preparation that we all have. So I'm going to jump right in and talk today about our policy work, and I'm going to have to get my bearing straight here with, okay, there we go. talk about our policy work and how that fits in the current environment. Certainly open to your questions and comments, so do be sure to put those into the chat box, and we'll allow time at the end to be able to address those. You see my disclosures here. You know I work for the Academy. I also am on the Scientific Advisory Board for Celebrate Vitamins, and I work with the Obesity Action Coalition as well as a board member. The vision of the Academy is thinking about a world where all people thrive through the transformative power. And we really went back and forth on this language when we updated our strategic plan a few years ago. We think that nutrition does have the power to change individuals' lives. And we'll talk about some of that as we go through the various policy efforts. But hopefully all of you that are here have an interest in this topic and can understand the importance of that particular statement. So what we are working to do as an organization is to accelerate improvements in global health through food and nutrition, but that doesn't mean that we don't touch on some of the other aspects of social determinants of health, thinking about healthcare in and of itself, thinking about physical activity. And we know that health and wellness really is a combined effort through all of these different sectors. We have prevention and well-being. I'll talk about that in a few minutes as part of our impact areas. And that really lends itself to the inclusion of mental health and thinking about the role that food and nutrition play, a nutrition status in and of itself plays in mental health. And so we're kind of trying to cover a lot of ground here, but there's no better time to be working in a field that is so connected to public health. Let me just I think I went one too many. So these are our strategic impact areas of the Academy's strategic plan. And the first is prevention and well-being. I touched on that. There's a lot of issues that underneath this particular area that we work to improve also fall underneath food and nutrition safety and security. But we have them in 3 different buckets. I'm going to give you a high level overview of various initiatives that we have going on in each of these areas, certainly not all inclusive. And I will tell you that we cover a lot of ground when it comes to food and nutrition. That means that we rely heavily on partnerships with other organizations, and truly in the congressional environment or working with federal agencies, it's really something that is so important, because going in as a single organization and talking about an issue, it's really tough to move anything. So you've got to go in. There's a lot of negotiation, conversation, collaboration. And what we bring forward to the conversation oftentimes is adjusted as we go through those negotiations with other organizations about what our position is going to be, so that we all can work together to move something. So again, prevention and well-being, healthcare and health systems, and food and nutrition safety and security. I shared the public policy priorities document with your team, and they'll be sending that out after the presentation today. So you're welcome to look at that. And of course, if you've got any questions about our priority areas, this is a rather long document. I think it's about 4 pages, but it has been recently updated, and it describes underneath these bullet areas that were on the previous slide some of the major initiatives that we're working on and how they align with our strategic plan. So they include things like disease prevention and treatment, life cycle nutrition, everything from birth through the Older Americans Act and aging programs, healthy food systems and access, quality health care, and health equity. Those are some of our issues that we're facing. I really wanted to spend a little bit of time talking about the current environment and sharing with you the work that we're doing here. Many of you are familiar with the American Rescue Act. That was the most recent COVID relief bill, the 4th that came through, and it's big. It contains so many different elements. I have a slide where I'm going to go into some of the call outs that we've made with regard to the legislation, but there is so much in this bill that is related to the Affordable Care Act or related to paid leave and other tenets that are in this bill that make it really a lasting impression. It's not just about COVID relief and stimulus, checks that are coming out. The next thing that we're seeing coming down the pike are kind of vacillating between these two bullets of infrastructure and American Families Act. And what's interesting about the infrastructure is I think most people intuitively would think about infrastructure as being roads and airports and bridges, those kinds of things. And certainly those are part of this infrastructure conversation. But what's also being touted in this infrastructure package is the idea of individuals as resource. So looking at human resource and the role that they play in the ability of our country to face a pandemic. What does our public health infrastructure look like? What does our food system look like? There's a lot of different ways that this idea is being interpreted. And as you can imagine, there's not necessarily 100% agreement or consensus on that broad interpretation of infrastructure, but I will tell you that those conversations are happening. And that then allows for some of the tenets of that American Rescue Act that are temporary, looking at issues like paid leave or child care credits, things like that, that maybe need a longer look or a more comprehensive look, may get readdressed in that infrastructure. And if not, then they possibly could come in that third bullet there under the American Families Act. So I think the administration really has some bold visions about where they want to go with some of these programs. And of course, there is a lot of politics that are happening just because of the very narrow majority that is enjoyed right now by the administration. It is going to be challenging on any issue to move it forward if they're expecting to go through normal order. That's why you're seeing some of these bills go through what we call a reconciliation process, which means that the Senate doesn't need to have the same number of votes that they would see through normal process. And then climate change, I have that on there. That's actually woven into a couple of these other bullets, including infrastructure, thinking of broadband and access for farmers to have, climate ability to use technology. And there are a number of other climate initiatives that not only woven throughout that, but that are standalone. This president and this administration certainly has elevated climate change. There's an overlap, obviously, with nutrition issues. I'll get to those towards the end of the presentation, but they include everything from agriculture, looking at the nutrient content of crops, looking at the impact of agriculture on climate change, looking at food loss, food waste, food date labeling. There's a number of initiatives underneath this that tie back in. So the American Rescue Plan, this was, again, the bill that was recently passed. Let's just take a glimpse at food security. That first bullet there, the extension of the SNAP program, was something that most hunger and food security advocates had been championing throughout the course of the pandemic. It was that this increase was needed, and it needed to happen through the end of the current federal year. And previously, individuals that were receiving SNAP that were in the very low food security category were already maxed out on their benefits. So when the pandemic hit, they weren't getting additional funds. And that was something that was thought to be necessary, was to increase the access to funding for those particular individuals. And you can see that there was increased funding for the senior nutrition programs. Those typically would be the congregate meal dining and the home delivered meals program. Of course, congregate meal dining has seen significant changes and flexibilities throughout the pandemic, so that rather than gathering and convening and consuming the meals, that they're shifting to home delivered. It sounds easy. It sounds like we should just be able to say you were over here and you were a congregate meal diner, and now we're going to deliver meals to you. But unfortunately, as the program was originally set up, there's not that flexibility to take that pot of money and just transfer it over here without some flexibilities that were granted early on during the pandemic. One of the challenges, as an aside to the bullets that you see here, that I just would parking lot and encourage you to think about, is that we advocated for flexibilities. They were absolutely necessary for programs like the Older Americans Act programs or the National School Lunch programs to allow individuals to receive food and to have access. It just was an important thing that we weren't able to get all of the food items and have the same types of menus and food systems that we had had previously. But as a result of that, it means that those nutrition standards, while they're relaxed, have also have health implications. So you're maybe not getting the same macronutrient or typical composition of meals that you would see, and the long-term implications of that are really something we're going to have to think about, especially as it comes to what has been the impact of the pandemic on our nation's weight. So a few other items listed there, just a really lot of positive food security funding, providing nutrition assistance to territories. We've done a lot to work for the Indian health infrastructure and continue that work as we get into this next bill as well. A couple of other provisions that were in there was 150 million for the maternal infant early childhood home visiting program. I think that's important for public health. We're also very much appreciative of this provision, which allows states, so that it's not a mandate at the federal government level, but states have the option of covering women up to 12 months postpartum, and there's increased flexibility for them to do that. We are hoping that this type of provision is something that we can continue to advocate for after the pandemic ends, and to also look at the gap year that exists between the women, infants, and children ending at 5 years of age and school age children. Do we need to bridge that age 5 to 6 in terms of food security? And then that last one is of interest during this public health focus. What is the infrastructure to establish, expand, and sustain that public health workforce? Much of this was geared around the ability of entities to be able to vaccinate and to get vaccines to folks, but there are other opportunities under that bullet as well. So more to come on that, I think, as it unfolds. So I want to shift gears and talk a bit about prevention and well-being. And again, I'm not going to go into all of the initiatives that we do underneath this area. There's a lot related to maternal child health that I probably would couch underneath prevention and well-being. You might think of school lunch, or I talked about the feeding programs for the Older Americans Act program. Those are actually for our purposes underneath that food safety and security. But when I think about this prevention and well-being, the two big pieces when it comes to public health are the dietary guidelines for Americans, and of course the Healthy People reports and goals that are set forth. And we have been involved for quite some time in the Healthy People. Those set the overarching goals for states and for counties, and looking at, adhering to national objectives and goals for reduction in a number of chronic diseases. And it really provides infrastructure for counties to establish their goals and to come up with funding for programs that align with that. The dietary guidelines for Americans just came out. There wasn't anything, significantly different in terms of the overarching guidance for adults, but what we did see in this instance was the inclusion of the 0 to 2 age group. In the US previously, we didn't have a consistent set of recommendations. I think we often deferred to the AAP guidelines and to recommendations that came out of federal agencies from programs like WIC or others. We began advocating back in about 2010, along with AAP, for the US government to include the 0 to 2 in future versions of the guidelines. So even though it took 10 years, we feel like that was a success. We feel like that there was a significant amount of misinformation that was happening in this particular group, and that it is difficult once someone turns 2 to all of a sudden impart dietary guidelines when you haven't provided that information previously. So I think that piece of it will be a work in process. There probably will be recommendations during the next version and updates to that. But overall, I think we're very pleased with the content. We also know and have already, I believe back in September was the first meeting that we had with Health and Human Services regarding the 2025 dietary guidelines. So even though the other ones hadn't come out yet, we're already working on the next version. And as you may know, the dietary guidelines alternate between the USDA and Health and Human Services in terms of who is leading the efforts. And so this next go round will go back to Health and Human Services. What is notable about the process is that this next version will pick up with the older Americans side of the dietary guidelines and examining how the needs of older Americans might be unique or vary, and what recommendations and information need to come out. And not much of a spoiler alert, but as we think about the DRIs and the need for those to be updated, then also thinking about the dietary guidelines and their alignment with federal nutrition programs. Those two pieces of it, are really important because the research supporting the DRIs is often not in the very old. It's the needs of 50 and 60-year-olds. And we're thinking now about individuals that are in their 70s, 80s, and 90s. And when you have the dietary guidelines aligning with those DRIs, what it means is even though an older adult might not have an appetite or eat as much, they're still required through the program to give the amount of food that they would give that 50 and 60-year-old. So we've got some questions and conversations that we want to have. The guidelines have involved into the implementation phase now, and really the focus of this set of guidelines has been on personalization and looking at your plate. So the My Plate campaign, being able to make cultural and personal preference adjustments to the types of foods that are consumed within the recommendations. And the appropriations piece down there that's noted at the bottom, I'll talk a bit more about that, but this is an area where we've taken the lead. Back in 2018, there were threats for the dietary guidelines, and we were able to step up and lead other organizations to say, not only do we need the guidelines, but we need to have specific funding set aside to support the process. And now we are also asking for additional funds to do a GAO, a government analysis, or accountability report related to dietary guidelines implementation, and to look at the nutrition research component of the dietary guidelines. So really exciting work there, and an opportunity for a lot of organizations to work together. We do a lot on licensure. I just wanted to mention that here, but I won't spend a lot of time. If you've got questions on this or you'd like to get more information, the pages related to licensure are open to the public on the Academy's website. And it's not an easy process. And I think individuals think, oh, we should just be able to come up with a national license, which we're not. We don't have the same infrastructure as some professions such as nursing. It really is a state by state situation. But we have been advocating. We have 21 states right now that are on our priority list that we're guiding through the process to add therapeutic diet order privileges, closing loopholes that might be there, and to think about the minimum qualification needed to protect individuals from unsafe practice. We are looking ahead. We know that telehealth is certainly an issue now with the COVID pandemic, and looking ahead to the 2024 graduate degree requirement, making sure that those licensure laws are in line so that there are qualified practitioners available and ready to do that important work. The next set is healthcare and health systems. There's a lot going on here with nutrition. I think no matter what age group you work with or the type of healthcare that you're involved in, there is always something in terms of advocacy that could be done. But thinking about, well, and I want to say back with the dietary guidelines, one of the elements of our comments that we made during the process was that we really need more research and science to support the role that food and nutrition plays across different populations, especially communities of color. And as we've thought about the pandemic and framed our work, we know that there has been a disproportional impact on many communities, especially those in Black and Latino populations, that COVID has hit significantly harder there. And some of that's related to nutrition status and health status because of access, longstanding in adequate access to food and nutrition, and to healthcare. And that's what this Medical Nutrition Therapy Act is about. This is a bill that would expand the coverage for MNT beyond diabetes and renal disease. It's something that the Academy has been having conversations about since we got coverage for those other two chronic diseases back in 2006. So this has been a long conversation, but the timing of it was finally appropriate for us to be able to ask for coverage for chronic diseases such as cancer, cystic fibrosis, celiac, thinking about cardiovascular disease, obesity, and others, including eating disorders. And it was introduced during the last Congress, but with all that was happening with the pandemic, we talked a lot about, again, the role that nutrition plays and in terms of chronic disease and how that would set up an individual for being at risk for the more severe side of COVID. But it's going to be reintroduced into this Congress. We are hoping in the House here in the next couple of weeks, and we have champions in both chambers. The bills have been identical, and we think that they'll be reintroduced in the same capacity. We're looking forward to launching a pretty major campaign for the Academy that includes both a public and a member-driven initiative. So if you're interested in helping to advocate for this, it is a Medicare bill. We know that issues that are advocated for and achieved underneath Medicare have a trickle-down effect to other healthcare entities. And so it's a good place for us to start. It is something that we can hopefully see results in, and then we can take that same type of policy and advocate for it through Medicaid or private party payers. A couple of other prevention priorities that you see are chronic disease. We have diabetes bills that we're working on, specifically looking at diabetes self-management training and increasing the flexibility, including allowing for nutrition and diabetes self-management to occur on the same day. We are advocating for eating disorder access for MNT across providers, TROA, which is the Treat and Reduce Obesity Act, a number of issues related to medically tailored meals. That's under the Food as Medicine Coalition. And then telehealth, what a broad topic to talk about. Lots of rules and regulations and laws surrounding telehealth that have to be considered. Certainly during the pandemic, we've had executive orders by many of the governors in our nation that allowed for telehealth, allowed for individuals to practice across state lines despite their licensure status, laws that, or excuse me, orders that allowed for certain types of healthcare providers to be able to do their work via telehealth. That's included registered dietitian nutritionists, but we've got our work cut out to make sure that those types of provisions are allowed to continue once the pandemic begins to resolve. And some of that surrounds the portability and the confidentiality of patient information. They had pretty strict requirements prior to the pandemic regarding the types of platforms that you could use and your ability to provide telehealth. Our members are using everything from Skype to email to telephone to FaceTime, and using, in some cases, those platforms that are compliant, but we're going to have some cleanup work to do there. And we just passed our own telehealth stances, so that will allow us, as we move into this next phase. We think that the Medicare flexibilities that have been offered for seniors will likely continue for quite some time. So it's not the Medicare, the federal government side of the telehealth. It really is trying to create a pathway for the individual states and how they're providing services. Funding priorities that right now is appropriations. It's one thing to advocate for issues straight up. What are we going to do about obesity? What are we going to do about diabetes or other issues? But every year we're faced with advocating for funding to go into these nutrition programs and services. And the Older Americans Act programs, we actually have seen increases in the home delivered meal and congregate meal dining programs through the last couple of years. And we just yesterday saw an email. We're going to be collaborating with a couple of members of Congress and our partners in this space to basically double the amount of funding that we saw for these programs a few years ago. So those are big increases to nutrition and increasing the access to meals for seniors. CDC grants, health education, looking at research and programs through the NIH, and of course, thinking about diversity appropriations for higher education. We've been advocating for outreach and dollars that would be available to minority serving institutions or HBCUs, historically Black colleges and universities, to expand allied health and to be able to target outreach for nutrition and dietetics. This appropriation process is very laborious. We complete forms for the appropriators and make justifications of why we think money needs to go to specific programs and services. And then we ask individuals to tell their story and give feedback on why is it important? What do these programs do for the district or state in which the member of Congress lives? So this funding piece is really where those services being provided require individuals that have the knowledge and expertise from a public health and nutrition standpoint to either provide leadership or to work in positions that can fully execute the program. So you can see the tie back into the jobs and services with the positive outcomes that individuals who receive the services are able to fully achieve. In terms of food and nutrition safety and security, this is always one that I think when we talk about food and nutrition, most people can really identify with the food security side. I put, will anyone forget 2020? Are we ever going to walk away and think about what we saw happening over the past year with regard to food insecurity, the images on TV where we saw food being discarded and the inability of our food system to get everything from eggs to agriculture, animals to potatoes, to just the whole supply chain was disrupted for a variety of reasons. But the bottom line is that food security over the pandemic has increased significantly. Simultaneously, what we're seeing is that individuals are, especially children, we're seeing increased incidence, prevalence of childhood obesity. That's probably related to a number of factors, including screen time, including food choices and availability, mental health and stress. There's just a number of factors that have contributed. And it's unfortunate because we were seeing positive impact of the Healthy Hunger Free Kids Act, of the changes through the WIC food package from 10 years ago, starting to see that have an impact on the prevalence rates. And so to all of a sudden have the flexibilities and to have food insecurity take such a big jump, it really has impacted the weight of our nation, and I believe is going to be something that all hands on deck will be needed to think about what our solutions and in terms of healthy lifestyles and the messaging will be as we get out of the pandemic. And certainly there's the opportunity then for, unfortunately, misinformation and I won't say fraud, but that's where my head went, but misinformation and, the opportunity for those who have unproven programs or products to try to take advantage of the vulnerability. I really think there's going to be a real push for weight loss products and other nutrition remedies. And unfortunately, with children, there may be some targeting that happens there to try to advocate for diets among children. And we obviously don't have time to get into that right now, but I just think that we need to be aware that there will be an advent of products that are going to be targeted to families who all of a sudden realize, oh my gosh, we're out of the pandemic and my family's lifestyle perhaps isn't where it needed to be. And certainly the changes that we saw with the Healthy Hunger Free Kids Act, we think that the Child Nutrition Act will come up during this Congress. And that means we have the opportunity to look at those nutrition standards and to think about the nutrition education, not just about the food that we serve during these programs, but we want to make sure that as we're recovering, that we're talking about the nutrition side of it as well. And so you see, again, we talked earlier about the disproportional impact on communities of color. Those were actually the groups, the lower poverty level individuals in the National School Lunch Program that had seen the benefits of the Healthy Hunger Free Kids Act. So not necessarily by race or ethnicity, but the lower poverty that are getting free and reduced were the ones that saw the most benefit from those nutrition standards that we employed. So it's important as we look ahead and we look for solutions to help bring health equity among all groups, that we really think about the role that nutrition plays in overarching health. A few other increases that we saw, lots of focus on making sure that individuals had access to their SNAP benefits, the Supplemental Nutrition Assistance Program that we had, pandemic, that the mechanism by which people were able to use their funds was made easier, as well as those flexibilities. So those are listed here, and I'm, for the sake of time, not going to go into each one. But thinking about food security as we move into this Congress, obviously a lot of administrative solutions. USDA has the capability in many circumstances to achieve administrative change, to make rule changes that are completely within their power, that don't require a congressional approval. And so in many instances, that's the mechanism we encourage USDA to use, that flexibility, and to drive the changes that they're able to make in policy. The stimulus packages and budget reconciliation, we talked about those earlier. Those obviously will continue to be major manners in which food security, healthcare, and prevention and well-being issues are addressed in this Congress. They do it also through the amount of money that programs receive. The final two there, I think, on the food security and side of this are really notable. So child nutrition reauthorization, one pillar that the Academy has been championing is, and along with other organizations as well, is Meals for All, thinking about food in schools as we think about textbooks, that we want to give children all the same ability to enter into a learning environment with access to meals without having to worry about free and reduced and who's paying, that we just are able to offer the healthy foods that we know will help them learn. And then Farm Bill preparation, we're already starting to talk about the next version of the Farm Bill. That's where a lot of that sustainability conversation will happen, but also, as you know, the SNAP program and the SNAP education programs are in the Farm Bill. And those are certainly pillars of food security that we work on throughout each Congress. So we don't wait for that reauthorization bill to come up. Also in that Farm Bill preparations, where that broadband infrastructure, if it's not picked up in infrastructure, it will probably be in that Farm Bill. And that's an opportunity for us to make sure, thinking back to healthcare, that those in rural environments have the technology needed to support telehealth, to support access to nutrition programs, including nutrition education. It all ties together. Strengthening federal nutrition programs. These are just a few of the areas that we are currently working on when it comes to food security, looking at reimbursement. We mentioned the universal meals. I think our vernacular is changing on that to meals for all. And then looking at WIC nutrition standards and access to fruits and vegetables, thinking about those senior nutrition programs. I mentioned that earlier. And then that last piece of it, we have a task force right now that's looking at nutrition education. We feel like there's a real missed opportunity in many of these programs to tie in why we're serving a certain type of meal or foods, or why the decisions are being made with children throughout their education experience, but across federal nutrition programs, to make sure that nutrition education and technical assistance are provided. We have been behind the School Food Service Modernization Act. Talk about that in a minute, but that bill would allow for grants through USDA to help with the purchase or the inclusion of upgraded equipment. You know, you can't, if it's so different to serve fresh fruits and vegetables and instead of foods that come through a can or a freezer. And so it requires changes in refrigeration, or how you store foods, or how you serve, and your food service line and management. So we need for schools to be able to shift and to use that equipment to provide healthy meals. And they do it not only for the children that they serve, but in some cases during pandemics or other types of natural disaster, those schools become a pillar for the community and healthy access to meals. We recently published our health equity and diversity issue brief, and this is the framing of how we weave the concept of health equity across all of these programs and services that I have described. It's a great overview. It sets the stage for us to talk about some areas that have been neglected in the past, and places where I think the academy can do better, but certainly all advocacy groups can think about the work that we do through that health equity lens. It's certainly been something that we've been focused on during this past year, and making sure that we have the right work staff to meet the demands of the population. In terms of sustainable food systems, the dietary guidelines implementation, food and ag research is a big one for us. There are efforts underway to look at NIH, to look at whether or not nutrition research should have its own office and additional funding. And of course, we support those kinds of efforts. It's just a matter of how do we get to that. But advocating for coordination between different agencies. The food date labeling bill is one that we have championed for a few Congresses, and this is intended to help consumers navigate the best by, used by, expires, all these different labels that result in food loss and food waste. Consumer education outreach, I kind of mentioned that, but also working on the food safety side with food allergies and traceability, making sure that there are pathways for us to identify problems within the food system and respond in an appropriate manner. So how can you get involved? This is from the Academy's website, the eatrightpro.org. This is not behind a membership only space. And so you can get to this page. And if you click on the Action Center, there's a number of action alerts that are open right now on a variety of issues. So I would encourage you to visit that, if nothing else, just to see what's on there. And when you get to that page, there is a pathway. If you're an Academy member, great, click on that. It'll take you to letters that allow your information in our system to populate and for you to take action as an Academy member. But if you're not, and you simply are a public member and you want to take action on these issues, you click that button and it will allow you to submit letters on your own. So either way, I think it's just great if you take action. So please visit that site. You can look on other sections of this page too. This is just one chunk of that landing page where you can look at the licensure information. We've got a number of issues that are listed there. The other thing that I'll mention is we have a pretty robust internship program, and we have taken a number of dietetic interns. I think we have 3 in the office, maybe 4 interns right now working remotely during COVID on a variety of issues. In fact, the health equity issue brief that I mentioned previously, it took us about a year, maybe a little bit longer, to get that issue brief done because we had a number of interns that contributed to authoring that particular document. But everything from writing issue briefs to leave behinds to attending hearings and reporting back, doing straight up advocacy, meeting with members of Congress or federal agencies. So lots of opportunity for interns. We have a process that you go through where you go to a introductory meeting to find out if it's a good fit for you, and then we work with you. We love having on-site interns. I think we're all hoping we can get back to that, where you come to the Washington office and you get that full experience of being on the Hill and going to events and meeting with members of Congress or, again, the agencies. But in light of the current environment, we certainly appreciate the ability to do this through a telecommuting environment. So all of our interns right now are doing their work remotely. So it's just an opportunity for all of you. We also take legal interns, and we usually have a two to four legal interns per year, and they are interested in food law and do everything from regulations and licensure to food safety, food labeling. And every once in a while, we're really lucky and we get a dietitian that is also a legal student, and we are able to combine those two worlds. We had that last summer, which was really fabulous. But just again, would invite you. And that last bullet there, the state legislative tracking map is an interesting place for you. If you want to go there, you can click on your home state or you can click on Pennsylvania, and it will show you based on search terms that we've provided. They're pretty predictable. They're, chronic disease and nutrition or food security, but you can click on that and it'll give you a pretty good idea of the current legislation in your state related to food and nutrition. So with that, I'm going to close and hopefully be able to answer some of your questions. Please feel free to email me if you're interested in doing some time down in our neck of the woods. I can connect you with my staff member, Liz Campbell, that oversees that. And we really have a great team. We're small but mighty, and just would love to help all of you get involved and to advocate for food and nutrition issues. So I know that was a lot of information, David, but hopefully there'll be some good questions.
No, it was fantastic, and I love the phrase "small and mighty" at the end there, because clearly you guys are covering a wide swath of different activities, and I'd love the fact that you ended with talking about internships, because we actually had 2 questions specifically on that issue, and I also love the idea that you had an intern with a JD. Temple is very fortunate in that we also have a public health law policy center in our law school that we have collaborations with, and my colleague Dr. Jen Ibrahim, who's an associate dean, is also affiliated with that center. And when I think about the new nutrition program that we're launching and the obesity center that we have and where we can be 5 and 10 years from now, that idea of doing more in the space of advocacy at the state, at the city, the state, and potentially the national level is definitely something that's on my radar. So we do have a bunch of questions, and I'm going to reserve the right, depending upon the time, to ask a few of them as well, because you touched on a lot of things that are near and dear to my heart as well. The first one is maybe gets back to where you started with the guidelines, and is a little, we're going to start a little controversial. The question was, how do you think the new dietary guidelines are going to address some of the criticism of how previous guidelines have been unduly influenced by lobbying from the grain and the dairy industries?
Yeah, I think what we hope for and what we advocate is for the integrity of the process, for the science. And that really comes back to the charge of the Dietary Guidelines Advisory Committee and the types of information and research that they can look at, and what we think is, sound nutrition evidence. And there's a lot of interpretation there. Our comments back to the Dietary Guidelines Advisory Committee were 104 pages, I believe. So, we had a lot to say about the science. Whether or not there's lobbying, look, that's a fact of life in this country. And I laughed today. I heard Mitch McConnell say, and this was completely unrelated. This was about the movement of the all-star baseball team. And Mitch McConnell said that these organizations need to stay out of politics. And I just laughed. I thought, well, at the same time, you're taking their PAC dollars and contributions, and you'll take their money when it comes to financing your elections.
Well, and he ended up saying that part out loud too, by the way. He said, stay out of politics except when it comes to campaign contributions, which, he said the quiet part out loud.
Yeah.
So
so I think for us, when it comes to industry, that the bottom line is people have to get the food, right? And there were some major challenges with the food supply chain that are driven by industry, and not in the way that you might think. For example, during the pandemic, the impact on potato farms, let's just pick that one. In Idaho, the majority of the crop it goes to industry. It goes to restaurants, it goes to institutions. Colorado, on the other hand, their potato supply goes to consumers, to grocery stores. Colorado didn't have an issue. Idaho had a big issue. So some of the larger infrastructure, like we need the food ultimately to get to the people. And well, why couldn't Idaho get those potatoes? Because they didn't have the relationships, they didn't have the packaging, they didn't have the distribution. If you're an egg farmer, you're going from having a pallet of eggs that you ship to a restaurant to needing to put it in something that is consumer ready in a 12 package carton. So there were a lot of challenges with industry, but my point is we have to work with industry to get food to people. Now, should they unduly influence? No, but the reality is they're going to be having a conversation based on their needs and what they're trying to do. We have one member of Congress that is really great for us on the school food equipment side of things. He's also from Pennsylvania in a very dairy influenced area, and he is very influential on the House Agriculture Committee. He's not going away. So we have to continue to have conversations with him. Last Congress, he introduced a bill, which he just reintroduced, asking for whole milk to be allowed in schools. And this bill has been around for a number of, it doesn't go anywhere. So we don't spend a lot of time advocating against the bill because it's a marker bill. He's doing that. We know that because of the dairy influence. Our response is we're going to go where the dietary guidelines go. So if, we're going to support those recommendations and the alignment in that case with the National School Lunch Program. The tension on the dairy issue, I am part of a paper that's about to come out where I worked with some very, very intelligent people who do mathematical modeling and looked at submission of comments for the dietary guidelines, and it's a massive number in electronic environment that make it questionable whether it's humanly possible for the federal agency to really take the questions and the feedback and to evaluate it and use it in a meaningful way. But what we found is a number of those comments were related to dairy. And I don't need to get into whether I personally believe, or even if the Academy believes, that dairy should or shouldn't be included in the dietary guidelines. What I can tell you is that the fact that the DRI for calcium is what it is, and you start looking at the food modeling to achieve that, it makes it difficult to say, how are we going to achieve a third or two-thirds of that DRI within the context of the National School Lunch Program, or looking at
Mhm.
senior nutrition programs when you omit dairy. Now, could it be done? I'm not, arguing that. I'm just telling you that there are a number of factors that come into play when we look at how we best achieve it. But I think the answer to the lobbying is to continue to advocate for science, to make
Mhm.
sure that we have science to back the conversations that we have, and for there to be the alternative perspective. Agriculture is a huge industry in the United States. It's a huge industry in a number of countries. It's how they feed their people in a number of countries. And so to say that something will or won't be, you start getting into conversations at a very high level. I think what we can do is, again, to make sure that the right conversations are happening,
Mhm.
um, and to push back. There were a number of instances where we said we were particularly concerned on the infant feeding side with the 0 to 2, whether or not there would be an inordinate amount of formula and artificial human milk conversation. That's a huge part of the WIC program
Mhm.
and honestly industry in the United States. And so we were concerned about that, but we really do feel like the recommendations hit a fairly decent spot on that.
Yeah, and I really like a lot about that answer because one, you've kind of pulled us behind the curtain a little bit in how this works. And I do think particularly for our students who are listening, as they begin to learn about these issues, the impulse is sometimes to say, and I have to be honest, I've used this phrase when I teach at the undergraduate level to drop the blame at the feet of big food, and to say that this is all their fault and that we kind of demonize them. But the reality is that doesn't help us move things along. If we turn this into a locking of the horns with big food, however we choose to define it, it's going to be hard to make progress. That we need to kind of work with them and find a path forward. And the other thing that you mentioned, both in this answer and your talk, which I'm glad you touched on, was the concern about scientific misinformation. That we had Dr. Tim Caulfield from the University of Alberta. You may be familiar with his work, but he does a lot on scientific misinformation. And he spoke with us back in the fall. And it's one of the things that we try to teach all of our undergraduate students, that regardless of their discipline, and our graduate students as well, regardless of their discipline, they have a responsibility to provide evidence-based guidance to their clients, their patients, the groups that they serve, and so forth, and that they need to be good consumers of what they, the journals that they read articles from, what they read on social media, what they hear over their backyard fence, because that's an important part of being a responsible professional. And I agree with you, and I really loved your example of, it will be interesting to see if come the fall, we start to see people kind of getting into that space of, did your family gain 30 pounds of weight during the pandemic? And all of a sudden we start seeing elixirs and supplements and all of this that we know are not going to be based on any evidence. And you can almost see that coming, and hopefully there are voices out there like yours that can help minimize it. So my colleague, Dr. Gina Trapicchio, sang your praises in about 3 lines, saying that this was really wonderful for her as well as the students. But she said that you also mentioned the Meals for All in schools as a nutrition effort to improve child health and nutrition. What are some of the challenges and barriers you've encountered with implementing a nationwide program like that, besides the obvious barrier of cost? And then how are advocates and policymakers thinking about packaging Meals for All and selling it to others in the next go round?
Yeah, so a great question, and thank you very much for your kind words. Boy, the cost issue is probably the look. It doesn't matter which side you're on. You can be Democrat, you can be Republican. Everybody wants kids to eat healthy and to live good lives. What they disagree on is who should pay for that. We've seen through research that the meals that are served through the National School Lunch Program are healthier in most instances than what children bring to school. So if we did a analysis of the nutrition from a meal that was brought from home versus somebody that was receiving that national school lunch program, the nutrient profile is usually better for the school lunch meal if they're getting the regular meal. So we know that it's healthy, and we know that there are specific links between learning outcomes and access to those meals. So that's one of the pillars that we're trying to focus on, is that it's a better environment for children. There's also stigma and bias. We talk about that in the weight world all the time, but there's also in the National School Lunch Program some biases that happen because children can be singled out on free and reduced meals simply by the way that they're being processed through the food service line. Sometimes if they have an outstanding balance, then schools will do lunch shaming, where they give them an alternative meal. You know, it's your meal of shame. You get the peanut butter and jelly or the grilled cheese. You don't get what everybody else gets. We're going to throw your tray away, in fact, because you can't, you haven't, your parents haven't paid the bill. And we just feel like that puts a child in a really different predicament. And we've looked at the need for textbooks and other resources. I mean, we're giving students laptops in this day and age. And the meals, when you took, if we were able to shift and require less administrative burden on the tracking of that free and reduced meal, and we could just provide the meals, we think that that would give great opportunity. There was an unsung, probably 20-year underground pilot project, if you will, in Philadelphia, where there was this idea of community eligibility and access to school meals. And so we have some examples and some data from fairly large school districts where we know that access to meals and community eligibilities have positive impact on the children and on the community. This is an area of expertise. Again, I've got Liz Campbell on my team, who is just an expert in this area and does a lot of really great work. We have an affinity group, we call it. So if this is an area of interest to you, there's a call once a month where we talk about what we're doing. We did write a journal article on universal meals that outlines, to your question, Dave, some of the challenges that we've seen in terms of implementing this. I think it's a heavy lift, and right now we're in an environment where kind of anything goes. So even if we were able to look at a temporary fix or some pilots back to make this a concept that, at least in areas where there was a threshold, if it was 75 to 80% free and reduced meals, that those particular areas could have universal access. I think there's some negotiating that's going to happen. It's a heavy lift, but what it does do is it gives us the opportunity to go in and to talk about food and nutrition, and to talk about the connection between school outcomes and food and nutrition. And so, we don't always get everything that we aim for. In opposition to some of this, the stronger nutrition standards and trying to increase the grains and limit the sodium, we've seen pushback by some organizations that feel like there's, kids won't eat these, it's too difficult to make the food. Our solution to that is schools need more technical assistance. They need people in positions that understand food and nutrition, and that translation into actual menu production. You're right, it is difficult if you don't have that experience or that perspective. And I think you have to see the system as, not just about going to school and having a meal there or having breakfast and lunch, but it's really what that does for the child in terms of health and wellness, and the interplay between the parent being able to work, being able to improve food security. It's part of a bigger picture and a bigger safety net. So to look at school nutrition without thinking of the broader concepts of how SNAP and WIC and other programs play into it, I think doesn't do it full justice.
So we're a couple minutes past 1. Do you have time for 2 very specific questions?
Sure.
Okay, so one of which is, I think, relates to what you were just talking about. It comes from my colleague, Dr. Jen Ibrahim, also singing your praises, and says, your work is impressive, but can also be intimidating. And I completely agree. For those of us who don't spend our time walking through the corridors of Congress, The idea of going there for the first time and shaking a congressman or woman's hand or a senator's hand is probably a pretty awe-inspiring event. How would you suggest, Jeannie, that students get involved in advocacy in this area? Do you have any specific recommendations for baby steps?
Sure. So the first thing is I would do a few things. I would go to that website and look at the action alerts. That's simply the easiest thing. You can send a letter and you can personalize it. That's an easy way to connect. If you go to congress.gov and you go to the lower right hand corner of that web page, there is a mechanism for you to find out who your member of Congress is. Just start following them on social media, follow them on Instagram, Twitter, Facebook, whatever you like, and sign up for their newsletter. And so you'll start getting an idea of the issues that they're involved in. We know that social media and digital advocacy can lead to results faster. It might take thousands of letters on an issue, where if you had a very meaningful post to someone's Facebook page or Twitter, you can get engaged with your member of Congress. So I'd say start being aware. And right now we're in this this phase with society where Twitter's kind of like a bathroom wall, right? Like people will just say whatever they want to say and walk away because they don't care who reads it or what the implications are. I would encourage you to be inquisitive. When you see things, to say, where is my member of Congress on this issue, and what is the issue? What are people saying, and how do I feel about it? And to the extent that you can avoid the group think and try to be the one that responds, that makes a connection, I think that that's really valuable. Shared experience. Members of Congress love hearing from students. You're the future workforce. You are the future voters and base of their particular constituencies. So they love to hear from students. And I think if you're interested in going to actual meetings, I'm happy to connect you. We have a great team in Pennsylvania that works on a number of state issues as well as higher issues. And you've got, Pat Casey, your senator, he's friendly to food and nutrition, and he has been involved on the Senate Aging Committee. He's been an important figure, but he's not as approachable as some other members of Congress to get issues moving forward. But he definitely is supportive of nutrition in children and in seniors as well. Pat Toomey, on the other hand, has been, less forthcoming on food and nutrition issues, but he's going out. He's not coming back. And so sometimes in that situation, they will be willing to champion issues. And again, it's not that they're in direct opposition of food and nutrition. It's about whether or not the federal government, the size of government, and whether government should be paying for certain things. And if people on the left only go talk to Pat Casey and people on the right only go talk to Pat Toomey, they're never hearing the opposite side from all of you. So, Elijah Cummings, who passed away last year, used to tell us, you don't need to knock on my door. You need to be knocking on the door down the hall. I'm not the one that's opposed to these issues. I'm on your side. Yeah. And I think that it's really important that members of Congress, no matter what side of the party they're on, that we have those frank conversations and try to dialogue with them. You learn great skills to communicate as a professional about food and nutrition, or to stand up in front of a room and give a presentation. And at the end of the day, members of Congress are people too. It can be intimidating, but if you just take the baby steps, start following them, engage in a dialogue, find an issue of passion. If your issue is dietary guidelines and the role of industry, you can go talk about that, because that's something you feel strongly about. If it's food security, just find your area, and you won't have to worry about messaging and talking points, and it'll just come from the heart. And I think that's what they want to hear.
Well, on that inspiring note, I'm going to hold my last question. I'll send you an email offline to get the answer for it, because I think that was a great lesson for our students. And again, given that advocacy has been our theme this week, it's something that in this space in particular, I think we've got a long runway in terms of what we can do as we further develop and refine our program and have that MPHRD program coming online. it might be a great way to really kind of get us thinking as a team about how can we get our graduate students involved in that, and can we have them really be that voice, like you said, of the workforce in the future as we wrestle with these issues. So again, I want to thank you so much. It's been a wonderful wonderful presentation. My phone has been blowing up from my colleagues saying how great this was to hear, not only those who work in nutrition, but also for those in our college who work on policy related issues, who don't always, oftentimes hear these things locally and at the state level, don't often hear them at the national level. So I want to thank you again so much for your time. It's been a wonderful addition to the week, and it's obviously after several years been great to connect with you again.
Great. Thanks, Dave. And please
Great.
feel free. Anybody can reach out to me. Look forward to hearing from all of you.
Great. Thanks again. Have a good day, everyone.
Yep. Thank you.